The most common symptoms associated with EoE are what is called dysphagia, that is difficulty swallowing, and perhaps less commonly, odynophagia, which is the term we use for pain on swallowing.
Having regular difficulty in swallowing can be associated with a rare and chronic condition called Eosinophilic Esophagitis, or EoE. Up next, we hear from Dr. David Armstrong to learn more about this little-known condition, which is rising in prevalence.
Eosinophilic esophagitis, or EoE, is a chronic inflammation of the esophagus with lots of inflammatory cells or white cells that are called eosinophils that are attracted into the lining of the esophagus, where they cause some inflammation and swelling, which makes it difficult for the esophagus to do its normal job of moving food down from the back of the mouth when we swallow into the stomach.
EoE affects around 15,000 Canadians. It's believed that many people living with EoE are currently undiagnosed.
It affects people of all ages. It affects men to a greater extent than women, and it is particularly associated with a history of allergic diseases.
EoE is currently the most common cause of difficulty swallowing and bolus impaction. The pain and discomfort of EoE can significantly impact quality of life.
The most common symptoms associated with EoE are what is called dysphagia, that is difficulty swallowing, and perhaps less commonly, odynophagia, which is the term we use for pain on swallowing.
Because symptoms are often confounded with GERD, a referral to a gastroenterologist is needed to receive the proper diagnosis. The diagnosis is made by an examination of tissue samples, biopsies, taken via endoscopy.
For someone who is suspected of having EoE, or indeed anything else that's causing swallowing difficulties, referral to a gastroenterologist or somebody who can perform endoscopy and knows what to look for is really important.
When left untreated, EoE is usually associated with persistence of symptoms and inflammation and can progress to permanent damage to the esophagus by stricture formation, narrowing of the esophagus. Food can have difficulty going down and can get stuck, often requiring an emergency intervention.
Once the condition has been diagnosed, there are now effective treatments that can lead to a significant improvement in your quality of life and reduce the likelihood that you will run into further problems with swallowing.
As EoE can be triggered by food antigens, a first approach treatment may be dietary elimination, most commonly, but not exclusively, milk, wheat, nuts, soya, seafood, and eggs. This can be difficult for patients to accomplish and does not treat the condition.
The main group of treatments for EoE are the steroids. So these swallowed inhalers have been shown to be effective, but they were not approved based on clinical studies. Other approaches were to take solutions of these steroids and mix them with sticky solutions so that they held up in the esophagus and coated the esophagus. But most recently, there is now an approved medication, which is a soluble tablet, or what's called an oral dispersible tablet, which can be placed on the tip of the tongue and allowed to dissolve. And this then trickles down the esophagus, coats the esophagus if it's taken after a meal, and taken twice a day. This has been shown to produce significant improvement in the inflammation and symptoms associated with EoE.
Dr. Armstrong shares one final message to those who may be suffering with EoE.
My main take-home message from this is that if you or somebody you know has difficulty swallowing, particularly if it's becoming more troublesome, then you should go and see your doctor. It may be EoE, this condition that was first described 30 years ago and is becoming progressively more common, or it may be something else related, for example, to reflux disease. But whatever the cause, it should be discussed, and it may well need investigation after discussion with your family physician.
If you or a loved one is presenting with symptoms of EoE, such as difficulty swallowing or food impaction, please speak with your physician about referral to a gastroenterologist. To learn more, visit these websites: cdhf.ca, badgut.org, foodallergycanada.ca,